Not every food is safe to eat during pregnancy. Some foods may be harmful to you and your baby because of the way they are cooked or because of the germs or chemicals that they contain. So let's look at 7 major foods to avoid during pregnancy. Number 1. High mercury fish. Eating fish during pregnancy is a smart move. Fish is an excellent source of protein, omega-3 fatty acids, and many other vitamins and minerals that play a key role in supporting your baby's brain development. In fact, it is recommended that expecting moms to eat 2 to 3 servings of fish per week. However, fish containing high levels of mercury can impair a baby's developing brain and nervous system. Mercury is a metal that can harm your baby. Fish get mercury from the water they swim in and from eating other fish that have mercury in them. By eating fish that contain mercury, you can pass the metal to your baby during pregnancy. This can cause brain damage and affect your baby's hearing and vision. If you eat fish, cook it so that the inside temperature is 145 degrees. High mercury fish to avoid include shark, swordfish, and marlin. Safer fish to eat include shrimp, salmon, pollock, catfish, and tuna. Number 2. Caffeine. Limit the caffeine you get each day. Caffeine is found in tea, energy drinks, chocolate, soda, and some over-the-counter medicine. Research has linked a high intake of caffeine to a risk of pregnancy loss, stillbirth, small weight at birth, and various developmental issues. Caffeine is absorbed very quickly and passes easily into the placenta. Because babies and their placentas do not have the main enzyme needed to metabolize caffeine, high levels can build up. It is recommended limiting caffeine intake to less than 200 milligrams per day during pregnancy. Make sure that you read labels on food, drinks, and medicine to know how much caffeine you're getting. Number 3. Undercooked or raw fish. Raw fish, especially shellfish, have a high risk of containing bacteria or parasites such as norovirus, Vibrio, Salmonella, and Listeria. Raw fish can become infected during handling, storing, and processing, including smoking or drying. These types of infections can cause dehydration and weakness in you, and if you're pregnant, some can pass through the placenta to your baby, even if you do not have any symptoms. Foodborne illnesses can increase the risk of preterm delivery, pregnancy loss, stillbirth, and other serious health problems. The CDC notes that the chance of having Listeria infection is higher during pregnancy than at other times. Number 4. Raw or undercooked meat, including beef, poultry, and pork. This could include hot dogs and deli meats. If you eat hot dogs or deli meat, cook them until they are steaming hot or just avoid completely. Hot dogs, lunch meats, pepperoni, and deli meats can also become contaminated with various bacteria during processing or storage. Eating undercooked or raw meat can also increase your risk of infection from bacteria or parasites, including Toxoplasma, E. coli, and Salmonella. Bacteria may threaten your own health and the health and safety of your little one. Most bacteria occur on the surface of whole pieces of meat, but other bacteria may linger inside the muscle fibers. During pregnancy, it is best to avoid any undercooked meat. In addition, processed meats can contain high levels of sodium and unhealthy fats. It is best to avoid deli meats and ensure that processed meats you cook, such as sausages, are cooked through. Number 5. Raw eggs. Foods that contain runny or undercooked eggs can be infected with salmonella. Cook eggs during pregnancy until the yolks are firm. Avoid sources with raw eggs. If you're making food that calls for raw eggs and won't be cooked, like a sauce or a spread, use a pasteurized egg products. Number 6. Unpasteurized dairy products. Raw milk and other unpasteurized dairy products can contain harmful bacteria, including Listeria, Salmonella, E. coli, and Campylobacter. These bacteria can cause food poisoning. These infections can all have life-threatening consequences for an unborn baby. The bacteria can occur naturally or result from contamination during collection or storage. Pasteurization can kill any harmful bacteria without changing the nutritional value of the product. To reduce the risk of infection, eat only pasteurized dairy products. Number 7. Alcohol. During pregnancy, alcohol increases the risk of pregnancy loss, stillbirth, and fetal alcohol syndrome. Fetal alcohol syndrome can affect many aspects of development, including heart and brain. Since there is no known safe amount of alcohol to drink while you're pregnant, it is safe to just avoid it. The bottom line is, when you're pregnant, it is essential to avoid foods and beverages that may put you and your baby at risk.